as young as 5 could start receiving the COVID vaccine as early as next month. Today, Pfizer asked the FDA for emergency use authorization of its vaccine for kids ages 5 to 11.
The FDA already granted approval for use in kids 12 and older, full approval. It's important to note, though, that once this vaccine is fully approved, it's the temporary approval. Once it's fully approved, all school children in California will have to be vaccinated to get into schools. News 8's Kelly Hessedal joins us live from Torrey Pines, where she spoke to a doctor about the concerns being expressed by parents. Kelly.
Yeah, and Carlo and Heather, there certainly are some parents who are concerned about their children getting the vaccine. One common thing we hear a lot about is people saying there just hasn't been enough time to study the long-term effects of the vaccine on children. So we talked to a doctor with UC San Diego, and here's what he told us.
What would you say to a parent who says the studies just aren't enough? I don't think it's safe enough to give my kid the vaccine.
I would probably engage in a discussion about what would be enough. What exactly are they looking for? Is it, 200,000 kids followed for 20 years, or something along those lines? But these are the data that we have now. They're very convincing. It is a large number of children followed for a pretty good amount of time. The kids did great. They generated an immune response that we were looking for. There were no serious adverse events in this group, and it prevented them from getting sick from COVID.
Now, that was Dr. Davey Smith, an infectious disease doctor at UC San Diego, and he says the research shows it is safe for kids as young as 5. Pfizer's trial involved about 2,200 kids ages 5 to 11, and he says none had serious side effects. He says they were given a third the amount of an adult dose, and the shots were given 21 days apart. Now, some children had minor side effects like a sore arm, or they felt under the weather for a couple of days, but again, nothing serious. Dr. Smith says not getting your child vaccinated is taking a big risk. Parents shouldn't assume their child won't have complications if they contract COVID.
The complications from COVID can happen early and it can happen late. And we don't know what's going to happen late from getting infected with COVID. We've all heard about this long hauler syndrome or the long COVID. Well, we don't know what happens to kids after they've gotten infected. Maybe they get infected and they do great. It looks like it's just a great cold, but a year, 2 years, 3 years down the line, what are the consequences there?
And in addition to protecting your child from COVID, Dr. Smith says by getting them vaccinated, you're protecting them from infecting other kids at school, as well as preventing them from infecting other older family members. Now, having said all of that, the Kaiser Family Foundation did a recent study, or a recent poll, I should say, of parents with kids ages 5 to 11, and they found that about a third of parents said they still want to wait to get their child vaccinated. Carlo and Heather?
Well, Kelly, what is the timeline of all of this if it should get this emergency use approval? When could that happen, and then when could it ultimately end up getting full approval from the FDA?
So as far as emergency approval, the FDA has a meeting scheduled for October 26th. So we're looking for a decision to come anywhere between Halloween through Thanksgiving, sometime between then. So it's possible kids could start getting vaccinated as early as November. It's unclear exactly when full approval would come, but for parents who do want to get their kids vaccinated, the advice out there is to talk to your pediatrician, ask the office if they plan on having the vaccine or providing the vaccine to kids as young as 5.
Kelly Hessedal reporting live for us. Thanks, Kelly. And again, the 12 to 16-year-old segment, they are in conditional use right now, emergency use. Full approval expected sometime between the end of this year and early next year. At that point, they'll have to get the shots to be in schools.
Yeah, that is certainly what the mandate is saying at this point, at least.